Welcome to our fourth patient education series on blepharoplasty. Our topic today is the lower blepharoplasty. What is a lower blepharoplasty and what does it accomplish? This procedure addresses the aging changes that occur along the lower eyelid. It improves the tired look by removing the so-called bags, the excess skin, and some of the wrinkles under the eyes, providing a more rested and youthful appearance. The bags are due to protrusion of the 3 lower eyelid fat pads. Although at times some of that fat needs to be removed, in most circumstances it needs to be repositioned. By repositioning and not removing much of the fat, the lower lid is not as likely to appear hollow over time. Usually, very little skin, if any, needs to be removed from the lower lid. How is this procedure performed? Classically, a skin incision is placed directly under the lower lid lash line. This is then carried through the underlying muscle to reach the lower lid fat pads. The protruding fat is then repositioned, and whatever appears to be in excess is conservatively resected. The extra skin is then removed and the skin incision is closed. Many plastic surgeons prefer a slightly different technique that does not interrupt the lower lid muscle. In this method, the lower lid fat is approached through an incision actually made inside the lower eyelid. This is called a transconjunctival lower blepharoplasty. If there is extra skin, it may be removed without interrupting the muscle by a separate skin incision just beneath the lash line. Although this technique involves a little bit more work, I prefer it because it allows the muscle to remain undisturbed, thereby maintaining lid support and minimizing the potential for changing the eyelid shape. More than any other structure in the face, the lower lid must be treated with great caution and respect. It is very unforgiving to aggressive approaches. There's very little room for error, and any skin excisions must be conservative. Excess skin excision from the lower lid results in a condition known as an ectropion, which is pulling of the lid away from the globe. This can result in distortion of the lower lid position. Excessive fat excision from the lower lid results in hollowness, with a sunken appearance to the eyes, which can create a worse and more aged appearance than the initial puffiness the patient had. Are there scars with the lower blepharoplasty? In a transconjunctival lower blepharoplasty, the incisions are made inside of the eyelid and there are no external scars unless some skin needs to be removed. In those circumstances, there is a very fine scar just beneath the lash line that is usually imperceptible. In some cases, laser resurfacing of the skin may be combined with a lower blepharoplasty. This would further tighten the skin and soften some of the fine wrinkles caused by the breakdown of collagen. In terms of recovery, the recovery after a lower blepharoplasty without laser resurfacing is usually about 10 to 14 days. There may still be some mild bruising that requires coverage with makeup, but if laser resurfacing is performed, recovery is a minimum of 2 weeks. I hope this has been informative. I believe that an educated patient will always make better informed decisions. To learn more about lower blepharoplasty, please visit our website, chicagoplasticsurgery.com. Thank you.